So I have been suffering from insomnia for almost 1 year. My average sleep is 1 to 4 hours, sometimes no sleep at all. And that's not good for my health. I've been suffering a lot mentally, psychologically. I feel like I'm breaking down. Um, I feel like I'm mentally breaking down. Uh, Especially I don't have any friends, so it's gonna make it even more worse. I feel like I'm dying. Yeah, so like I want to make some friends at least online. That's my goal. Um, at least have some virtual friends. Um, yeah. How did it start? Well, insomnia. This is what I want to share my experience. How it started. Um, so hopefully nobody else makes the same mistake. But I don't know for sure, 100% how it started. But I could only make my own theories about it. Um, well, before I had insomnia, I was doing shift work for 2 years. I've done the night shifts, and even then, I didn't have much of sleep problems at that time. Like my sleep wasn't perfect, but I was still getting 6 to 7 hours of sleep. It was sometimes hard to fall asleep, but I was still getting sufficient sleep, I would say. The only issue at that time was falling asleep, and like it's not easy to fall asleep in the daytime. So that was one issue. But sometimes I would have some bad days where I like only sleep 5 hours or 6 hours. But majority of the time I probably slept close to six hours or seven sometimes. So it was fluctuating from 5, 6, and 7 hours. There was only one incident when I was doing the night shift where I started having kind of panic symptoms. Like there was one day I couldn't sleep for the entire day and have to go for my night shift. At that time, for one day of not sleeping, I was having panic attack. Um, I don't know if it was a panic attack or something else, but it was like a medical emergency for me. I start to feel like at work my face was getting frozen. Like I can't feel my face. I cannot feel my nose. So it's like you start feeling like body starts to freeze. It was very scary thing for me. So I had to call the ambulance, and basically I told them maybe I'm having a stroke, but they told me if you're having a stroke, you will have it on one side of your face or not the entire face. So it wasn't stroke. Basically, probably was panic attack. And I talked to some other guy who had similar experience, but it's not due to sleep, but it's due to stress. He told me he had panic attack, and it felt the same thing. He passed out eventually, like from he felt like his face was getting frozen. His body starts to freeze, like you feel like you cannot move, and you get really scared. You don't know what's going on with your body, and then you pass out. uh, I didn't get to that stage yet, but I when my face was frozen, I start to experience like difficulty breathing also. Like I felt like I was very close to pass out. I felt like I was dying. But when that happens, also your heart starts to race, like it starts to go up. And I think at that time when the ambulance came, they told me my heart rate was high, um, a little bit high, but they didn't think it was stroke. But when they did the ECG and everything, they said, "Okay, you're fine. You're okay. You could go home." So basically, it's panic attack. When they don't find the reason, they blame it on panic attack, basically. I mean, the whole thing of panic attack, people experience it. No one really knows a lot about panic attacks, right? There's not much knowledge about them. And it may not be actually, you're not scared of anything. Like sometimes you get them not because you're scared, because of some chemical imbalance somewhere. But they call it panic because it's a symptom of your heart going up, and our heart goes up when we're scared, right? So that's why it's called panic attack. But you're not necessarily scared of anything, right? It could happen on a day when you're not feeling scared of anything. Anyway, so that was why I'm saying this. Like, I have panic attack for one day of not sleeping. Now I could go days. Now 3 years, 4 years later, I could go. Now my insomnia became more worse. I could go for 3 days without sleep, and I'd still not have the same panic attack I had before, right? Like when my face got frozen and everything. I still have different kind of panic attack, but not the same. But it doesn't happen every day. That's what I'm trying to say. Like before, what my body was very sensitive. So one day of not sleeping, it caused me panic attack. Now I could go some days without sleeping, I still don't get panic attack, right? Like unless I go 2 to 3 days usually, and I end up having panic attack 2 3 days I don't sleep, then I might have a panic attack. But my body is like getting used to not sleeping. So like the more it gets used to not sleeping, I become more tolerant to not having that much panic attack. But usually the lack of sleep does cause some level of panic attack, I guess, or anxiety. Yeah. Um, I don't know how to solve it. I don't know how to solve my issue. I mean, I went to a family doctor. They're useless, kind of useless or careless. A lot of them. I mean, the healthcare in Canada here is not really good when it comes to helping people with mental illness or with insomnia. They treat insomnia as a mental illness, by the way. Um, in my opinion, I think people with insomnia, they should be at least hospitalized for it until they get the problem fixed. And it really doesn't make sense why they don't hospitalize people with insomnia. Um, I mean, you'll see all kinds of people going to hospitals, mental hospitals, for stupid reasons. You know, maybe some guy beat up his wife, and they put him in a mental hospital, or some guy beat up his kid or got in a fight with somebody. It was for stupid reasons to put them in a mental hospital. But for the people who really need it, they don't really offer that help. They don't really offer the help. Like the healthcare system for mental health sucks. When you go to the hospital, they tell them I have insomnia, I haven't slept for 3 4 days. They will laugh at you. They'll tell you get out. You're okay. We don't like I did it once. I went after 3 days of no sleep. I went to the hospital. Like I don't know what to do. What else to do? And the doctor there at the hospital told me, well, he told me you have mental illness. So I I'm not trained to deal with mental illness. I'm only here um I'm only here to deal with medical problems. And your issue is not medical; it's mental illness, right? So that's how they treat you here in Canada, basically. Like they don't entertain you if you have a mental health issue. They don't try to help you with at all. They make fun of you. Even the paramedics made fun of me once. Like he's telling me, uh, "Oh, you're the guy with the mental illness, right?" I'm like, "No, I don't have mental illness. I'm just having insomnia. That's it." Like every time I have to call the ambulance for a panic attack or some sort of thing, and they were like, "Oh, you're the guy with the mental illness, right?" I'm like, "No, that's not true. I don't have mental illness. I have insomnia." Like there's the stigma. They have like they look at you. I don't know. It's like they look at you like you're a guy who has mental illness, right? And they don't want to help you because of that. It's like they don't want to deal with mental illness. They're not equipped to help people with mental illness. Like even if it was mental illness, they should have helped me because it's affecting me physically as well, right? So like right now, my heart is suffering. I think like my ECG is not coming normal anymore. Like sometimes I don't know. Sometimes it's normal. Sometimes it's showing up. It's not normal. I think because the lack of sleep is affecting heart function for some reason. I think so. Um, Eventually, like according to literature, um, according to literature, insomnia poses a risk for stroke and heart attacks. So they should treat it as a medical condition because it will lead to a medical condition. It could cause any like failure of anything basically. It will reduce your immune system. It will cause kidney problem, liver problem, all these problems, digestion problems. So it is a medical issue, but they're not treating it as a medical issue. They're treating it as a mental illness and they're brushing it on the side. It's a mental illness that they cannot deal with it, right? So that's how they're treating it. And even then, they don't want to help you. Even they want to look at it as a mental illness, and they don't want to help you with that. So I've gone through a psychiatrist, and I told her like every medications I took, it was giving me side effects. I cannot take them because most of the medications I tried, from SSRI to Z drugs, the Z medications like Zopiclones. Um, I've tried antipsychotics like quetiapine. Almost all of them except the Zopiclone. Almost all of them, they caused my heart rate to go up. The Zopiclone, it gave me a little bit of anxiety. It was not that much strong. Like it had a different type of anxiety than raising my heart. But it's kind of anxiety, but it's not raising my heart. But it did do something to me, the Zopiclone. Like because Zopiclone is very similar to the benzodiazepine class of medications, and it could cause seizures. It could cause a lot of things. And I couldn't take it for too long, right? I only took it for 10 days, I think, and I stopped after that. Like it wouldn't work after 10 days. It would not work on me. Like this is what happened. My body got used to it. So I'm explaining this to the psychiatrist. Like most of the medications I tried, they don't really work. Oh, we're gonna keep giving you trying different medications, more medications. I'm like, no, I don't want to go through this experience on my own here at home. Like what if something happened to me? Like because every time I take it, my heart rate will go up to 160, 180 sometimes, which is like I have tachycardia. I have increased heart rate. This is what these medications are causing. They're causing my heart rate to go up very high. And not just my heart rate, my hand will start to shake, and I have difficulty breathing also, and I have difficulty, like sometimes I feel like I'm gonna pass out, difficulty staying awake. Like I know these medications are meant to make you sleepy, but they're not meant to like increase my heart rate and then make me feel like I'm gonna pass out. So that's not normal. This is not something I want to take, right? So the psychiatrist told me I can't help you if you tell me your medications are giving you side effect. I cannot really help you. Basically, she just didn't want to talk to me, right? Hospital didn't want to help me. Um, then I had to go back them to give me something else. They said to go for CBTI. I go for CBTI, which is CBT, cognitive behavioral therapy for insomnia. That's what it stands for, right? CBTI also was useless to me because I was already doing the behavioral changes CBTI requires before I went for CBTI. Like part of the CBTI, you see follow up bed hygiene, uh, some sleep habits like don't watch your TV, your phone, don't use your phone while you sleep, don't do this, don't do that. So I tried all that. They will say get up after 15 minutes if you don't sleep, get up and walk around or do something until you feel sleepy and then go back to bed. Well, that doesn't work for me because for me the issue is even if I get up from bed and try to do something, read or whatever, I could stay up all night and I will still not feel drowsy. I will still not feel sleepy. So it will not work for me. And I tried to explain this to the therapist that was giving me all these tips on how to improve my sleep. And she told me, "Oh, if that's the case, then it's not going to work for you." Right? Even she told me that it's not going to work for you. So this is the issue now. I don't know. What I'm like. CBTI is not working. Medications are not working. Uh, I don't know what else to do. To be honest, I don't know what to do. Like, I tried different herbal pills to see if they will work. All people have different suggestions. It's valerian, from GABA to valerian to melatonin to all these things. Like there are 5 6 herbal stuff I tried. Passion flower, um, various herbal stuff I tried. Chamomile tea, and none of them worked for me. So herbal magnesium, I tried magnesium, and also the same thing. It was giving me panic symptoms. Magnesium. So I couldn't take it. It was not also helping at all. No, I don't know. Like I tried everything from natural to pharmaceutical to CBTI, and my average sleep now is like 1 hour a day with 2 hours. Sometimes no sleep, and it's been like this for a year now, almost a year. I don't know. The stupid thing about the hospitals here is that if you're not at risk of hurting somebody or hurting yourself, they're not going to admit you as a mental patient. That's a stupidity, because if I don't go punch somebody in the face, they're not going to put me in the hospital. If I don't go try to commit suicide, they're not going to put me in the hospital. They're not going to admit me in the hospital, right? Unless like the only way to get myself into the hospital, I have to go punch somebody in the face. Like that's the only way. Like it might happen actually. Like I might do it because eventually, like, I cannot handle it anymore. My body, like, I feel like my body is about to collapse. Um, like it's too much tired. Like when you don't sleep, you get this feeling in your chest sometimes. I can't explain it, but it feels like you get tightness in your chest, like in the middle of your chest, and I think that's the location of your heart. So when we don't sleep, our heart starts to get tired, and then you will feel that you will feel it in your chest, in the middle of your chest. So the heart is tired, and it's not just the heart, but also the you'll sometimes you'll feel chemical changes in your body. You will feel it like smell. You feel like a chemical smell in your nose, or sometimes down your throat. You'll feel some chemical taste. What else? Sometimes I get this chill feeling in my arm, like I will feel like something like a chill feeling. This maybe some sort of anxiety kind of thing, because So I don't know, you feel like very similar to like dying. Like, I don't know, like a person who's very sick and dying, like that chemical feeling in the body, it feels the same way. Like as if somebody is killing you or punching you or beating you up, and then you get this, maybe it's cortisol, I don't know, maybe that feeling is high cortisol level. I cannot verify what it is unless they do a chemical test on me or hormone test. Well, I try to do that. I try to get my family doctor here in Canada to refer me to an endocrinologist, the hormone doctor, to see if I have any hormonal imbalance. So, however, my doctor was not convinced to do it. He's like, well, there's no evidence, there's no need for you to do that. I'm like, what do you mean there's no need? There's literature all over the place that says when people don't sleep, they have a hormonal imbalance. So I was thinking, at least if I cannot take psychiatric medications, at least I'll do some hormonal therapy, hormonal replacement therapy. Maybe that will help me shift, fix my sleep somehow. Maybe that will fix my mood, or if it's a mood problem, it will fix it and it will help me sleep. No, he was not convinced. So I go try 3, 4 different doctors, the same thing. They're not convinced. One doctor eventually I managed to find, like, he's like, okay, I'll have to do first, before I refer you, I have to do some tests, thyroid, whatnot, whatever. Um, Thyroid, I told him, okay, but I know my thyroid is normal. It's not my thyroid that's causing my sleep problem. You have to investigate. You have to investigate the circadian rhythm hormones. I don't know. Like, it's like I have to educate the doctors what tests they have to do. I don't know. Like, it doesn't make sense. Like, they should themselves do it right away. I don't. I shouldn't even have to push them to do it, because literature says, scientific literature will say, like, when you don't sleep, most likely your circadian rhythm hormones will be out of balance. This is according to literature, to science. So, circadian rhythm hormones will be like growth hormones, testosterones, ghrelin. I think one of the digestive system hormones, like so, like, there are, cortisol is one of them. Cortisol. So when these hormones go out of balance, your circadian rhythm will be off balance as well. So this is the first thing they should have tested. So I managed to convince this doctor to do a testosterone test. He tested it first time, it was low. Second time, he wasn't convinced. He's like, oh, I have to test it again now. So wasted more time testing it again. Third time, it came even more lower. So now I know I have testosterone level. And he's like, well, is it affecting your sex drive? I'm like, no, it's not affecting my sex drive. It's not affecting anything. Like, it's just affecting my sleep. I don't know, like, because it's testosterone. Testosterone doesn't necessarily affect sex drive. I know it's a sex drive hormone, but it also plays a role in the mood, in affecting your mood, right? Your energy, your mood, your energy, right? So I told him, like, no, it's probably affecting my mood and that's affecting my sleep. So I need to get that fixed. He's like, okay, I will refer you to endocrinologist. But guess what? I have to wait 4 months for endocrinologist appointment. 4 months. 4 months. And guess what? My wife, who's pregnant, doesn't even need endocrinologist. They keep pushing her every week to go see an endocrinologist. She's able to get an appointment every week very quickly, and she doesn't need it. And she keeps telling this endocrinologist, I don't need it. I don't want to come here. But they keep pushing her to go. Like, this is the crazy thing about our healthcare system. I'm the guy who's calling the ambulance every day, going to the hospital every day, not sleeping, suffering mentally, suffering physically. Amir, suffering physically, mentally, calling the ambulance every day, going to the hospital almost every day. And yet, they make my appointment within 4 months. This shows you how much they care about people with insomnia. This shows you how our medical system really care about people with insomnia. Hospitals don't want to help you. Endocrinologists, they make your appointment for 4 months instead of dealing with you right away. Like, they really care. They really care. This is how much they care about us. It's a broken system, really. Like, they need to fix it. This is why I'm making these videos. Like, I want to bring awareness to this issue. Like, I want to bring awareness that doctors need to take this more seriously, because it's not just insomnia. Insomnia could lead to other health problems, and they have to take it seriously. Like, right now, my heart is not probably functioning properly, and it may lead to cancer. Insomnia could cause a lot of health problems. Cancer, heart problems, liver, kidney, you name it, stroke, heart attack. Like, almost every health problem that exists, insomnia causes it. Diabetes. So they want me to get sick. They don't want to treat it because they do want me to be their patient. They want me to be a patient. Like, that's why I'm saying I should be in the hospital right now, because if I don't, I'm gonna end up being in the hospital anyways, a few years down the line. Like, I should be hospitalized for insomnia. I don't want to take medications at home. Try different medication. I've already tried 5, 6 medications. How much more do you want me to try? If you want to experiment on me, okay, just do it in the hospital. At least if something happened to me, you could deal with it, right? I don't want to take it here and pass out and nobody knows I passed out and something happened to me. I don't want that. At least if I'm gonna experience some symptoms from the medications, at least it should be done in a safe place like a hospital. I mean, I don't mind trying. I'm not saying I don't want to try any medications, but I want to do it in a safe place. I don't want to do it at home, you know, because every time I do it at home, I have to call the ambulance. I have to do all these things, and it doesn't make sense to call ambulance every day, you know. Like, I don't want to be calling ambulance every single day. Yeah, I don't want to be doing this every day, calling the ambulance, or every day feeling panicky and all this. I don't want to go through that experience. At least it's traumatizing experience for me. It's been, to every day call the ambulance, or to feel my heart rate going to 160, 180, and my hand is shaking. It's very traumatizing. But if I was in the hospital at least and I have these symptoms, at least I will be less tense about it. Because I'll be like, okay, like, I have panic attack, maybe I'll call a nurse, I'll call a doctor, or like, at least I will not be as much scared of the experience, right? So I'll be more willing to try different medications. But right now it's like I feel like, no, I don't want to do it anymore. Like, what if something happened to me, What if my heart rate goes up, and then I cannot bring it down, and then I have a heart attack, and then I cannot call the ambulance, because nobody will know I'm having a heart attack. Nobody will know I'm having a stroke. Like, I know my wife lives with me, but sometimes I have to give her rest. She has to sleep. So she sleep in a different room. So what if I'm by myself, right? Nobody's gonna know I'm having a heart attack or having a stroke from these psychiatric medications. I mean, I've read also a lot of the literatures about the pharmaceuticals, of the psychiatric medications for sleep. A lot of the psychiatric medications, they cause all health problems. There isn't a health problem they don't cause. Heart problem, I mean, they cause all sorts of problems. These psychiatric medications, from heart to liver to kidney, diabetes even, they are as bad as insomnia itself. But if they're short term, it's okay. I'm willing to take the risk. Short term, maybe it's not gonna cause that much problems, right? Maybe I'll be lucky not to have any side effects on some of them, right? Like for some of them, maybe I will not have that many bad side effects. So that's why I'm willing to try, but I don't want to take too much risk to the point where I could hurt myself, right? Get hurt. And this is what I'm trying to tell my doctor also. Like, if I punch somebody, you're gonna take me to the hospital. But if I'm taking different herbal supplement, that's gonna hurt me, because I even end up calling the paramedics for some of the herbal supplements I took, because I was experiencing also side effects from the herbal stuff. So I'm like, I'm experimenting with herbal stuff. I might hurt myself. I might hurt myself. Why you don't put me in the hospital? Because I cannot control myself anymore. When I'm desperate for sleep, when I'm having anxiety from not sleeping, I'm desperate to get some sleep. I'm doing I'm doing some things that are wrong, like out of my control. I'm not in control anymore. In desperation, I'm behaving wrongly, and I could hurt myself. But they don't want to admit me to the hospital. When I'm telling them I could hurt myself from this herbal stuff I'm taking, and they still don't want to admit me to the hospital. But if I tell them I'm gonna hurt myself by attempting to commit suicide, they will probably admit me, but not right away. After doing some assessment, of course, to see if I'm really at risk of killing myself. So this is the issue. This is the biggest issue I have to deal with right now. Um, and of course, I could hurt also myself from taking pharmaceuticals. Like if it's giving me side effects, I might end up having a heart attack from pharmaceuticals, from the psychiatric medications. Then why don't admit me to the hospital when I'm at risk of hurting myself, right? No, unless you punch somebody in the face, they're not gonna let you in. Unless you threaten you're gonna commit suicide, they're not gonna let you in. You could hurt yourself by taking pharmaceutical, it's fine. You could hurt yourself by taking herbal stuff, it's fine. They're not gonna help you. But they will only help you if you punch somebody in the face. Ridiculous system. It's a ridiculous healthcare system. I cannot express how bad it is. Like even if the endocrinologist helped me, at least I was reading. It might actually help me, the hormone therapy. It might, because when we don't sleep, our body don't make enough hormones. A lot of these circadian rhythm hormones are made at night, mostly made at nighttime, right? When we sleep. According to literature, from what I read, like growth hormones could make people sleepy, right? I could be wrong, but this is it was one source I was reading. There's like a growth hormone stimulator thing. I don't know, stimulators. Like they stimulate the growth hormones productions. So they did give some people this growth hormone stimulators, and these people experience drowsiness. So this shows that these circadian rhythm hormones can affect sleepiness. So I probably have growth hormone, lower level growth hormone as well, testosterone and growth hormones. So if they give me replacement therapy, it might help me restore my sleep. Because insomnia is also, it's a vicious cycle. When you don't sleep, you don't make enough of the hormones that is supposed to help you sleep, right? And it continues. And that's why you need to break that vicious cycle somewhere down the line to fix it. And maybe a hormone replacement therapy could break that vicious cycle, and then that could restore my sleep, right? But no, they want to force psychiatric medications on people, even though literature says, I remember reading one scientific article, and it says that psychiatric medications, they only work on maybe 20% of the people that they take. Most people will experience side effects, that's why they don't take it, and that's why it doesn't work on them. Even psychiatric medications don't work on majority of people. They still want to push psychiatric medications on you. They want you to be sick because psychiatric medications can cause health problems. They want you to be a sick person so they can make money and profit. It's ridiculous. Now, I'm not saying I don't want to take psychiatric medications. They do help some people, and I'm not saying they're bad, totally bad. For some people, some medications is a miracle. I was reading online also some people how they benefited from taking psychiatric medications, and I tried myself, but they don't work on me, right? Like some people, they have depression and they take SSRI and their problem is solved. But I don't have depression. My insomnia was not caused by depression, it was caused by something else. All right. And taking depression medication is probably not going to help me. And these depression medications don't help me anyways, even if I had depression. Like right now, I do have depression because of the lack of sleep, of course. You gotta have some depression if you're not sleeping, right? But even then, they don't help me, right? They don't work well on me. And I don't want to take benzodiazepine. I know because I took it before and I felt like I'm gonna die. And it's very risky also. Benzodiazepine, you have to be monitored by a doctor who is loyal to you, who cares about you, right? If you feel like your doctor doesn't care about you, then very risky. And I don't want to take it. It affects your breathing. It's like you're taking general anesthesia, basically. I mean, you could have a stroke, heart attack, if you experience withdrawal symptoms from benzodiazepine. It's the most dangerous drug you could take. That will be like the last drug I will take if I have the last one, if I have to take any psychiatric drugs. But I noticed something about myself, my body, is that antipsychotics, usually I'm more tolerant toward them for short term, but if I take them long term, maybe long term, they don't do very well. Antipsychotics. I still experience panic attack if I take them for long term. Like quetiapine is an antipsychotic, right? But maybe I have to try different antipsychotic medications. Quetiapine did help me for 2 weeks, I think, sleep. But after 2 weeks, I started having tachycardia, or increased heart rate, right? So in this channel, I'm hoping that I'm gonna try to talk more about my insomnia and see what different methods I try to sleep, to help me sleep, and if maybe I'll get some people to give me some feedback, what worked for them. Maybe it will help me as well. I don't know. Thanks for watching me.